My name is Darcy, and I own Hopkinton Audiology in town, and right off of 495, right above the 110 grill. I like to go around and give these lectures to the senior centers because there's a lot about hearing aids and hearing loss that people don't always have the answers to, and so I like to make sure that you get to ask questions and get some of that information. So, a little bit about me. I am a licensed audiologist. I'm certified by the American Speech Language Hearing Association. I have my undergraduate degree from the University of Colorado in speech therapy, and then I got a Master of Science in Audiology at Northeastern. I spent 5 years working at the Cambridge Health Alliance in the ENT department. I was at BJ's in their hearing aid center for about 1.5 years, and then I opened my own practice in Hopkinton, and I've been open for about 6 years, almost 6 years in November. Today, we're going to talk a little bit about hearing in general, the anatomy, how your ear works, how to read the audiogram, some of the impacts of hearing loss, how to prevent hearing loss, and hearing aids. So 3 in 10 people over the age of 60 have hearing loss. Most people, when they think of hearing aids, they think of an elderly population. However, 14.6% of baby boomers also have hearing loss. And people that are closer to my age, there's about 7% of people. I always tell a story. The very first experience that I had in grad school, I did hearing testing for babies at Mass Eye and Ear, and I tested a set of triplets. 2 of them ended up with hearing aids, and 1 of them ended up with a cochlear implant. So even though most people associate hearing loss with the elderly, it is a very common problem for all ages, not just as we get older. And again, kids can be born with hearing loss or develop it from different syndromes and things as they get older. So in terms of hearing loss, it is pretty much spread out across all of the different ages. Kind of the 64 to 84 is the higher area of hearing loss, but anyone can have it. Okay, so this is our ear, and I have a diagram of this up in my office, and I use it all of the time to explain my audiograms to my patients. You have 3 different parts of the ear. There's the outer ear, which is basically the ear that we can see plus your ear canal, the middle ear from your eardrum to what's called the cochlea, and then the cochlea goes up to the brainstem, and that's the inner ear. There can be disorders of the different parts of the ear. So, I want to go back. What we always do when you first come in is we look in your ear to make sure there's no wax, because if there's any wax blocking the eardrum, then you're not going to get a good hearing test and we won't get the best results. Doctors look in there. If you have an ear infection, they can see the fluid behind the eardrum. We can't really see into the inner ear, but I'm sure that a lot of you have heard about the hair cells that are in the ear, and that's actually what the next slide is. So the sound comes in through the ear canal, moves the eardrum, moves the 3 bones in the middle ear, and then they get into the cochlea. Once the sound gets into the cochlea, it moves these little rows of hair cells. So you have 3 rows of outer hair cells and 1 row of inner hair cells. The inner hair cells take information from the brain, and the outer hair cells send the information for the sound to the brain. So I know you probably have heard about when the hair cells are damaged and what that means. When they're not working appropriately, they're not getting those sounds up to the brain. Again, these are some nice healthy hair cells where you can see They're nicely lined up. They're, straight lines, little triangles. But as we get older, whether we take medication that can damage our hair cells, we are exposed to loud sounds, different things like that. This is what happens. Those hair cells disappear and they don't grow back. And so my job is to try to give you sound to help to make up for the spots where the sound is missing from. They get bent, they get broken off, and depending upon where that happens, that's what can lead to some of the hearing loss. So this is an audiogram. This is what I use to measure the levels of your hearing. What I always do is once I get the results of the test, I go over this with patients. But on this blank one, I can show you it's kind of the opposite of what people normally look for. The really soft sounds are up at the top, and the really loud sounds are down at the bottom. So when you have hearing loss and you're down here, it means that you're missing all of the stuff up at the top. And this is low pitch to high pitch. We mainly, in audiology, focus on the speech frequencies, where words are going to be, because that's our job. If we test it out above 8,000, it's more for musicians and things like that, where they're a little bit more concerned about those higher frequencies, but these are the levels that we worry about. So this is an audiogram with a hearing test on it. So normally we use red circles for your right ear and blue X's for your left ear. So this person has hearing at about 5 decibels, which is in the normal range. If you drop down a little bit, it's a mild hearing loss. A little bit lower, you have moderate, severe, or profound hearing. I have a lot of patients that have profound hearing loss that are not deaf necessarily. They still use hearing aids. They don't have a cochlear implant, but the hearing aids have to be more powerful. And these other things, it shows you kind of where a lawnmower sound would come in, a dog barking, birds chirping are up in this area. And these are where all the sounds of speech come in. So I use this a lot when I talk to patients because there's 2 parts to hearing loss. There's the volume, which is what this graph shows us. And then there's another test that we do where we have you repeat back some words. And the goal of that test is to determine how well you'll actually do with a hearing aid, because a lot of people wait a long time before they decide to get a hearing aid. And in doing that, some of the cognition and the comprehension of speech stays delayed. And it's because, I'll show you on another graph, a hearing loss audiogram. But if your audiogram looks like this, any of those sounds above my arm are sounds that you're not hearing anymore. And the longer that you go without hearing those sounds, your brain starts to forget what they sound like. That doesn't necessarily come back with a hearing aid. What will happen is, I always say, it's like if you break an arm and you don't go to the physical therapist or to the surgeon and get it repaired, and 5 years later you say, oh, I want to get it fixed now, it's never going to work the same way as if you had done it, when you first injured it. So that's kind of what all of this is all about. As I go along, if there are any questions, you can feel free to ask. You don't have to wait until the end, because I know I'm going through the slides. So if something comes up on the slide that you see and you have a question about it, feel free to ask at that point. So again, this is just a different way to look at the hearing loss. Normal is to 20, mild is 21 to 40, moderate, severe, severe, and profound is anything over 90 decibels. So if you have hearing loss at 95, 100 dB, you're missing quite a lot of sound. So this is that word recognition. That's what I was talking about, where we have you repeat back words at a certain level. It's done in quiet, and it gives us an idea, like I said, of how well you'll do with the hearing aids. The closer you get to only understanding 50% of the words, the less benefit you'll receive from a hearing aid. Some people come in and they have just a mild hearing loss, but they can have a pretty significant, they could be down at 60% word understanding. Other people come in and they have a more severe hearing loss, but they can have, excellent word understanding. There's really no way to predict it, but it's definitely an important part of the test. So we're going to talk a little bit now about the different types of hearing loss. There are 3 different types. There's sensory neural, which means that it's in the nerve. It means that the sound gets through the outer ear, the middle ear, and then somewhere in the cochlea up to the brainstem is where the hearing loss is occurring. It can be in the hair cells, it can be in the nerve, it can be anywhere in the inner ear of the ear. Conductive hearing loss is when something is impacting the ear canal or the middle ear space. And so that can be wax. Wax can cause a conductive hearing loss. Fluid. My son had a moderate conductive hearing loss before he had tubes put in. The other thing that can be conductive is sometimes you have 3 bones in your middle ear space, and sometimes one of those bones can get stuck. Usually, if it's a conductive hearing loss, it's something that can be surgically handled by an ear, nose, and throat doctor, and it can bring the hearing back up a little bit. If it's sensory neural, the only thing that you can do is usually hearing aids. They're not going to be able to do a surgery for you that will make the hearing better. And a mixed hearing loss is when you have a little bit of both. Your hearing is down, but then you also have something going on in that middle ear space. Typically, in my practice, I mostly see adults. I am not a pediatric audiologist, so most of the time I see sensory neural. Every once in a while, I will have someone with more of a mixed loss, and I usually refer them to the ear, nose, and throat doctor so that they can see what's going on internally. They'll do CAT scans or MRIs to figure out exactly what's causing that gap component. So this is a pretty typical hearing test that I see. A lot of people come in because of noise exposure, whether they're musicians, whether I have veterans that have been in the Army and been exposed to loud sounds there. The world is a very noisy place. So I am a huge proponent of earplugs. I have gone out to concerts. I've been out to Indian Ranch to hand out earplugs. I do a lot locally to hand out earplugs. I've been talking to my son's school. I have an 8th grader. So I make sure that I tell everyone the best thing you can do is protect the hearing that you have, because once it's gone, it's never the same. When we do get it back to you, it's not the same as what you could have protected. But this is pretty typical where you have some normal hearing and then it drops down into a more severe, moderate to severe range. And we always see it drop right at 4,000 hertz and then come back up. So this is very much what we see with noise exposure. So some of the effects of hearing loss. I'm sure you've heard people say this. Everyone mumbles, or I just have a hard time when we're at the restaurant, or I can't hear what you're saying. There's a lot of whats or hus, or can you repeat that? It has a big impact on people. I've had a lot of people coming in during the pandemic when all the senior centers were closed. They would come see me and they would say, I'm not spending time with my family because I can't hear them. I don't want to have to keep saying what. When we're sitting around the table, I just sit there. I don't know what anyone's saying. it starts to cause, some depression, some anxiety, paranoia that they're talking about you, that, you don't have an idea of what's being said. So it's not just that you're not hearing things. It can start to impact your social, emotional ideas as well. Again, it can lead to depression, anxiety, that social isolation, and a poor quality of life. I just had someone come in the other day. She could only hear out of one ear. I fit her with one hearing aid, and her daughter was ecstatic when they came back for their follow-up because she was like, she's involved now. I want her to have that good quality of life where she can be a part of the conversation and be a part of everything. So it's important. So some of the effects of untreated hearing loss, you lose that acoustic information going to the brain. So again, those words, if you're not hearing those certain sounds, your brain starts to forget what they sound like. A lot of times people come in and they think that just by putting a hearing aid on, everything's going to be perfect. And what I do when I do that word understanding test, we usually do it at a louder level, so it's as if you had the hearing aids on. And I'll say, look, in quiet, you only got 80% of the words correct, even at a louder level. So even with your hearing aids, you're still going to be missing some words. And it's important to recognize that because hearing aids are not they don't fix everything. So they do have limits. And I make sure that people know that going into it, because otherwise, if you think everything's going to be perfect, you're never going to fully adjust to the hearing aids. So this is a big thing that I want people to understand. There's two types of hearing care providers out there. There's audiologists, and then there's hearing instrument specialists. An audiologist, currently you have to earn a doctor of audiology. My class that I graduated in 16 years ago was the last year that you could earn a master's. So after that, everyone that graduates is now a doctor of audiology. We do 4 years of academic after our bachelor's, and then we have a clinical training year where we work with a professional. We are trained to diagnose and treat disorders of the ear. So I had a patient come in, he had one-sided hearing loss. It was sensory neural, it wasn't conductive. I sent him to the ear, nose, and throat doctor, and he had what was called an acoustic neuroma. So he had a benign tumor on his auditory nerve. There are other tumors that can grow in the middle ear space. These are all things that I can do the hearing test and determine based on the results that something like that is happening, and then I refer to a doctor that would help. A hearing instrument specialist, you can graduate from high school and just take a licensing test after, I think, 3 months of taking classes, and their job is they do a hearing test solely to fit a hearing aid. You're going to find hearing instrument specialists at like Miracle Ear, Bell Tone, places like that, Costco. An audiologist will usually be in a private practice, in a hospital setting, with an ear, nose, and throat doctor in their private practice. There's definitely a difference between what you're getting in terms of service. And I always say to patients, I don't care if you come to see me, if you want to go someplace else, that's totally fine. But please make sure you're going to see an audiologist, because you will get better communication skills. You will get better care in order to make you hear better. So that's my big takeaway, but I just want to explain kind of the difference, because a lot of people will come in and say, I saw an audiologist, and I'm like, no, you didn't. You saw a hearing instrument specialist. So there are some other symptoms that are associated with hearing loss. It's not just not being able to hear. I'm sure a lot of you have heard of tinnitus, which is the ringing or noise in your ear. It can be any sort of noise. It doesn't just have to be ringing. My grandmother used to say she could hear a clock ticking. She heard what sounded like a train in one ear. So it can come and go. It can, for some people, it can make them very, very anxious. There are no easy remedies for it. A lot of the times you'll see herbal over-the-counter treatments for ringing. They're not going to work. Tinnitus is usually caused by damage to those hair cells or somewhere further up in the brain pathway. There have been people that have had tinnitus so bad that they've actually had their auditory nerve severed to help not hear it, and they've still heard it. So there's no guarantee of where we're going to find that. A lot of times I'll have people come in, and usually by wearing a hearing aid, it can help a little bit. It's not a guaranteed fix, and I always tell people that up front. But in my office, when I put a hearing aid on someone, sometimes they'll say, wow, I don't hear that ringing anymore. So your best bet when you have something like that is to see an audiologist, because we have some skills to help you deal with it. The supplements aren't going to do it. The other thing is hyperacusis. And you probably have heard some people say things about this. It's kind of counterintuitive. Hyperacusis is when sounds are just way too loud. And so when you have hearing loss, you would think, well, I want something to be louder. But with hyperacusis, there's a fine line of what we can give you in terms of volume to meet your hearing loss, but then what's too uncomfortable. And we have to walk that balance of what's going to work for you. And diplocusis is actually when you hear the same pitch at different, same tone sounds different in each ear. I have never seen this until about 2 weeks ago, and then I actually had someone come in that had this diplocusis, and she would say, when you do my hearing test, it just sounds different in each ear. So for her, it's a matter of finding and balancing the hearing aids so that she doesn't feel like one ear is different than the other. In terms of hearing preservation, I do, like I said, I recommend earplugs. When I go to concerts, or my kids go with me to concerts, we wear musicians' earplugs. I have a lot of friends that are musicians, so these are designed to filter everything at a certain level, so music sounds better. You can get some sleeping plugs. A lot of patients come in, they have a hard time with a partner who snores. And then just normal noise plugs can be the foam ones you can buy in the store, headphones, or some custom bigger plugs that protect you from sound. This is just a little graph that shows you how loud certain things can be. So for OSHA standards, you can be exposed to 85 decibels for 8 hours before you start doing any damage. One of the things that I like to do when people come in is I say to you, what is your life like? Are you mostly at home? Do you go to the senior center? Do you take classes? Do you see your family a lot? Do you go to restaurants? Because there are different styles of hearing aids, but then there's also different technology levels. And I take all of that into consideration when I make my recommendations for you. A lot of people come in thinking that they want the in-the-ear hearing aid, which looks, I have other slides that will show you too, but this is kind of what that in-the-ear one would look like. Or a lot of people have this more behind-the-ear style that does a little bit more, and it's based on hearing loss. You know, some people come in and they're like, I want an in-the-ear, and if they have that normal hearing that drops down, I say an in-the-ear is not going to sound good because you get blocked up, you get an echoey feeling, you hear yourself. So my recommendation is based upon how well you'll hear, but I also take into consideration what you're saying. And then, like I said, the technology, there's the lower level ones I usually give to my patients that are mostly at home, that might have a family member come visit. living in a nursing home, something like that.
Working in a nursing home.
Well, but living in a nursing home where, you know, they're mostly just, you know, in bed or whatever. If you're working, if you go out to dinner, if you have family around, I usually recommend at least a mid-level of technology. And the reason that that is because it does a better job of turning down the background noise. There really is a difference in terms of the level of technology and how well and how quickly that background noise can be handled by the hearing aids. So these are my fun slides where you get to kind of take a look back at what hearing aids used to look like. This was from the 1930s, and this was a vacuum tube hearing aid. I know that this was a little earbud that would come up to the ear, and then I think that those would sit in like a pocket or something like that. But I just want to show you, hearing aids really have come a long way from what they were. These were some cameras and hearing aid purses. I'm not exactly sure how these worked because I don't know how you could hear through a camera. But it's an interesting part of the hearing aid history. Some tie clips and some barrettes. Those make more sense because they're up closer to your ear. Eyeglass hearing aids, which have actually been coming back around. People have been trying to figure out a way to make it so that you can hear through your eyeglasses. It's not working, but they're working on it. And this is actually a body aid. And so this was the microphone, and it would sit in a pocket, and then this would come up to your ear and you would hear. I've been practicing for 16 years, and I have actually seen one of these being used when I first started. They're not very common anymore, but they were still out there about 15 years ago. So these are the more common styles that are available now. You can have what's called the completely in the canal, which is teeny tiny, and in the canal, which is a little bit more visible, half shell, full shell, behind the ear, and this is an open ear, little teeny tiny one. So you can't, I don't know if you can see it, but there's a little wire right there, and there would be a piece that sits behind the ear. These are some other pictures of the same thing. These are the custom ones. So the way that these are made is we actually take an impression of the ear. So we put a little piece of cotton in, put in some material that will harden, and then we send this to the manufacturer, and they make the hearing aid based on the shape of your ear. This is the standard behind the ear hearing aid with a full ear mold in the ear to get the sound in. This is for someone that has a very severe loss. They are the ones that still need that traditional behind the ear hearing aid with that bigger, thicker ear mold in the ear to get that sound into the ear. This is what a lot of people are wearing now. It's called a receiver in the canal. And it works a little bit differently in that the microphone is behind your ear, so that's picking up all of the sounds, and it transmits down a wire into what's called a receiver. So the amplifier actually sits in your ear canal. And the nice thing about this is that you can have a more closed up dome to keep more of the sound in, or for someone that has more normal hearing, or like normal to mild, you can have an open dome, so it allows the sound to kind of move naturally, and we're not amplifying the normal hearing only where the hearing loss is, usually in the higher frequencies. So these are some of the ways that they look, some of the different manufacturers. These are some of the newer hearing aid styles, and I brought these, if you guys want to come up here and look at the end, I brought a few different little dummy hearing aids with me. So there's now a big thing about the last slide, those receiver in the canal hearing aids, is that they're now rechargeable. This is one of the custom rechargeables, which is a fairly new thing. Before that, they all required batteries. These ones look almost like earbuds for people who are younger and don't necessarily want hearing aids, but they need them. They look kind of like an earbud. These ones have a slightly different style, and the charger actually holds a charge, so you can go away for a couple of days camping or whatever without needing to plug in to something. It used to be that these custom hearing aids were more popular, but now that they've come out with those receiver in the canal, behind the ear style hearing aids are definitely the bigger amount of sales. So when we look at what hearing aids are going to work best for you, these are the things that I take into consideration. How well you're hearing in quiet, and how well you hear in noise. Everything else is, these are the main ones. And so, like I said, someone that's at home, they just need a hearing aid that's going to make things a little bit louder. They're in a quiet environment. They just need to be able to hear. For some of my younger patients that are still working, I have some lawyers, different people in different jobs where they're in meetings, they're in conferences, they're on phone calls, and they need the hearing aid to do a lot more for them and a lot faster. Not everybody needs that. Some people just need to be able to hear in quiet with their spouse or whatever. So this is kind of what I look at when I look at hearing aids for people. So it used to be that there were just analog hearing aids where you had a little screw on the back of the hearing aid, we'd just turn it, and we didn't have a lot of control over the sound. Then digitally programmable analog came along where it was still a very loud sound that wasn't very frequency specific. Now everything is completely digital, so when you come in, I hook you up to the computer and I will go through and we can adjust whatever frequencies we need to depending upon the problems that you're having in different situations. And this just goes, like I said, the screw pots with the analog. Then it became you could kind of adjust it from the computer, but you still had limitations. With the programmable analog, we were able to give you programs, but you would have to push a button to change between like a quiet environment and a noisy environment. And there was some data logging, so we could kind of see what situations you were in with the noise. Nope, wrong way. So then they started going up, so now the hearing aids can kind of learn a little bit. A lot of times you can have an app on your phone that you can make adjustments in the situation so that it helps you to hear a little bit better. One of them now has a dual processor, so one set of microphones focuses on the speech and another processor actually focuses on the background noise. And they all kind of have acoustic sensors. So now instead of needing to push a button to change from a noisy program to a quiet program, the hearing aids are doing it on their own. So they'll put you in the situations and they'll adjust everything so that you're hearing better how you need to. A lot of people like that because they can just put their hearing aid on and leave it and not have to fuss with it throughout the day because it's doing all of that stuff in the background for you. So it's become a lot more simple for patients. The noise reduction, the hearing aids are focused and designed to turn down noise. They do work together, so if you have hearing loss in both ears, you really should get hearing aids for both ears. One side, if you're talking to someone on your right side, that side will detect the speech and amplify it, whereas this side is just getting that steady state noise and it will actually lower it. So it does give you better hearing in that situation. It comes with different programs. Some of my engineers, even though the hearing aid does a lot, they want to control it and they want to have different programs. They now have more microphones. So the ones that go behind your ears have two mics on each hearing aid. So they're better able to figure out where the sound is coming from and how to adjust it. These are some of the accessories. So again, the charger. Some chargers you have to be plugged into the wall. Other chargers you can take with you and, if you're camping or something, you don't need to plug it in. This connects to the TV so that you can actually stream the TV directly to your hearing aids, so it gets rid of all kind of that ambient noise. I have a husband and wife, and the wife had her hearing aids set up to stream from the TV, and the husband just got new ones, but because They already had one device. He went with hearing aids that would work with that. So he was like, this is amazing. He was like, I can hear the TV down in the hall. Some people need to have a microphone that they can hand to other people. My best friend's sister isn't much older than me, and she's interviewing for jobs right now. She has hearing loss in one ear, and she has one of these, so she can hand it to the principal or whoever up at the podium so that she can actually hear him better while they're talking. These are the apps, and again, they have different controls where you can change programs, you can adjust volume. This allows you to control the microphone a little bit so that if you are having a hard time in a restaurant, you can actually turn off the back microphones and only use the front. Or I have some people that use this when they're in the car with their grandchildren, and they'll turn off the front microphones and only have the back ones on so they can hear what's coming from the back seat. So these are all things, you don't have to use them. I have a lot of people come in, I don't want anything fancy. There are options that we can turn on if we want to, but you don't have to. So this has become more of an issue lately. There's definitely a difference between hearing aids and personal sound amplifiers. Hearing aids you're going to buy from an audiologist or a hearing instrument specialist, and they're fit to your hearing loss from your audiogram. They're more expensive. Usually it's bundled, so part of what you're paying for with the price is when you come in for repairs and adjustments and things like that, you're not paying me every time you come into the office. You could have the same hearing aids for 8 years, and when you come in, I'm not charging you anything extra because you paid it initially in that fee. We can fit any hearing loss from mild to severe to profound, and as your hearing gets worse, we do a hearing test every 1 to 2 years, and as your hearing gets worse, we just make your hearing aids louder. And typically you get a 3-year warranty. So any repairs or anything like that, we send it out. And they also cover it 1 time per ear if you lose the hearing aid. Personal sound amplifiers, you buy online, you buy at the grocery store, at the CVS, whatever. They're programmed by you. You do a little hearing test on your phone, and then you program the hearing aids yourself. They're way less expensive, although some of them can still cost up to $2,800, like Eargo. I think Nano was one of them you could get online, which is still really expensive. You can get some lower end, older hearing aids for that money. You have no follow-up care. So you buy these things in the grocery store or online, and you can't go anywhere to get help because audiologists aren't trained to work with them. And they're really only meant for mild to moderate hearing loss, and they usually only have a 1-year warranty. The big thing for me is if you don't have your hearing tested before you use one of these, and you put it on and you program it the wrong way, you can actually do more damage. I have one woman who came to see me. She was wearing an amplifier. I tested her hearing. I fit her with a hearing aid. I fit it to her audiogram, and she was like, this isn't loud enough. The other one was louder. The other one was whatever. She was actually starting to damage her own hearing by using it inappropriately. So I always recommend at least getting your hearing tested professionally, even if you don't get a hearing aid. Insurance. Medicare does not pay anything towards hearing aids. Sometimes some of the supplements do have insurance benefits. I will tell you, Tufts with Hearing Care Solutions is one of the better Medicare supplements. For a mid-level set of hearing aids, it's usually about $2,400 for the pair, which is still expensive, but if you came into my office without insurance, that same hearing aid would be about $4,500, so you're saving quite a bit of money. Blue Cross and Blue Shield has a company called True Hearing, and United has, I think it's actually now called United Hearing Healthcare, not Epic. With these Medicare supplements, you are limited. So you do pay less money up front, but you only get 1 year of service with the provider. After that, There's usually co-pays and things like that when you come in for office visits. And so, yeah. So always check with your insurance or talk to your audiologist and see what's available. I do work with all 3 of these supplements, and I've been seeing a lot of those patients lately. So this is just a little bit about everything we've covered. We went over the anatomy, we talked about how to read the audiogram, what some of the impacts of hearing loss are, the different styles of hearing aids versus PSAPs or personal sound amplifiers, and insurance. Does anyone have any questions?
How long does a typical hearing aid last?
Hearing aids typically last 5 to 6 years, but I will say as long as you take care of them, most of my patients can get them to go 7 to 8 years, and then they really do recognize that the technology has changed enough that they want to move on to new ones. So you're looking at probably every 6 to 7 years needing new ones. Thanks for listening.